7:49, just 10, short of 10 minutes before we get to the top of the hour. Let's take a look at some more health stories having come from the World Health Summit of 2025, which is underway in Berlin. Our previous chat that we had there with Dr. Krishnan, the World Health Organization TMC unit head for TM Research, Data and Innovation. We now focus on Dr. Chido Rwafa Madzvamutse, who is medical officer for mental health at WHO Africa. Our topic being the World Health Organization Regional Office for Africa, having launched a new mental health data portal, an interactive platform that tracks mental health trends across the continent. This portal combines data from national surveys, global health databases, and regional frameworks to give policymakers, researchers, and health professionals a clearer picture of mental health needs and system capacity. It also includes an AI-powered chatbot to improve awareness and access to information. So Dr. Madzvamutse joins us now to tell us more. Doctor, thank you for making time for us. Good morning.
Good morning, Hassan. How are you? Good morning, everyone.
I'm well, thank you very much. And let's delve right into it then, in terms of starting by you explaining what exactly this mental health data portal is and why WHO, or World Health Organization Africa, decided to create it.
Okay, so data on mental health has been rather scattered across different databases, global databases, regional ones, country level surveys. And this makes it very difficult to actually see a picture of what is going on with mental health or neurological substance use issues across the region, but also even with individual countries to actually see the bigger picture. So the dashboard was created to integrate this data and make it easily accessible and easy to interact with. It's intuitive, it's user friendly, and the chatbot allows a conversational. Allows people to interact with the data in a conversational manner. So really it's about improving access to information about different indicators where we've got the information. Obviously there's still some gaps, but it allows us to access the information that is currently available.
Have mental health trends changed much across the continent, or is it a case of just more awareness on these trends, but not so much of developments and a pivot in what you've seen?
There are some improvements, not what we would like to see, but many countries now have mental health policies. 29 in the African region of the 47 that we followed now have a mental health policy. 16 now have a budget line for mental health. 7 now are integrating mental health into primary care. So there are improvements, but when we see it on a regional scale like that, it then also prompts us to know where the gaps are and where we should be putting more emphasis and advocating for.
So, what is the type of information that users can find from this portal in terms of how they can put it into practice?
Okay, so we've got some sustainable development goals that are specific for mental health, things like suicide rate, things like alcohol use per capita that you can find. Then we're also looking at burden of disease, so looking at prevalence of common mental health conditions like depression, anxiety. We've got quite a long list that we managed to get some data on that has been included. Then there's also a regional framework that countries endorsed in 2022 to try and improve mental health systems. So you can get regional level data and country level data for where it's available on some of the indicators for that framework. These are issues around whether a country has a policy for mental health, whether that policy is aligned with international human rights standards, whether the country has a dedicated budget line for mental health, whether they're integrating mental health into primary care, if they've got a suicide prevention plan, and whether they're integrating mental health and psychosocial support into emergency preparedness and response. And then we've got some other surveys like the Global School Health Survey, which some countries have done, and they've got some information on mental health, as well as the STEP study, which is mostly to do with NCDs, but some countries have also included a few questions on mental health. So where that information is available for those countries, you'll be able to access it. And these are all published surveys. So this is information that was previously available. It was just not in one place.
Talk to us about this AI-powered chatbot and how that supports mental health awareness and access to mental health services.
So it's not really to support services, it's to access the data on this portal. So if you've ever been on databases, sometimes they're very overwhelming. You get there, there's a lot of data, a lot of information, and even for experts, sometimes it's hard to navigate around it. So we took advantage of the availability now of AI, where you can have a conversation and you can extract data through a conversation, as we do with the different AI the available technology that is there. So you can ask a question. Let's say you want to know the suicide rate in a specific country or the regional suicide rate. You simply ask a question, you type out a question, and the bot will be able to search the contents of this dashboard and be able to then supply an answer. One of the other issues of being overwhelmed with information is if you ask it on an open platform, you might get a lot of information, some of which maybe you don't need. But this information, this chatbot will be limited to the information that is in the dashboard that we know is verified by countries, that we know is verified by the region, and you'll be able to get answers. It's a conversation. You can continue that conversation to say, okay, you've told me the regional rate. Now I want to know what the rate is in these several countries. I want to know what the alcohol use per capita is. I want to know what the burden of depression is in a specific country. If the information is available, it will let you know. If it's not, then it will be able to tell you we don't currently have that information.
As we talk of a continuation of conversations, how can researchers, governments, and partners contribute data to this space? And how can they use the portal to guide decisions on mental health, especially on policy-making level?
So this is very important. On the landing page of the site, the dashboard is available on the WHO Regional Office for Africa website. On the landing page, there's actually an option for users to get in touch with us and provide us with any additional information. Of course, we would have to verify this. If it's at regional level, we'll verify it at regional level. But if it's at country level, we would have to verify with the country in question to say, is this data verified? Where was it sourced from? The other way that governments can contribute is to actually participate in the global surveys that have been done. The Mental Health Atlas that is done every 3 to 4 years. The STEP surveys, if they're intending to do one. This all provides us with very important information that we can then feed into the dashboard. But of course, we would need to verify it. And then researchers can and policymakers can move around the dashboard, get the information that is there, be able to then come up with summaries of information that they need on mental health. Each country that has completed the different mental health surveys, the mental health atlas surveys, actually has the country summaries of the different years available. So you can access summarized data on mental health systems for each country. And then you can start to make decisions. If there's no policy, it might be time to now develop a policy. If there's no budget for mental health, that's an area that we're often advocating for governments to have dedicated budgets, because we can't actually change systems if we don't put money towards some of these challenges. So this is how we are hoping that the data will be able to inform policy reform and inform resource allocation as well.
Thank you so much again for your time, Doctor. We'll leave it there for now as far as this chat.
Thank you, Asanda. No, thank you very much.
Dr. Chido Rwafa Madzvamutse from the World Health Organization Regional Office for Africa, explaining the new mental health data portal, a tool aimed at strengthening mental health systems. It tracks trends across the continent and supports evidence-based policy decisions.
Start your day right with Channel Africa